Hope you all will be fine. So starting with where we have left last lecture, we have discussed up to the regulation of insulin release, how the release of insulin is controlled from pancreatic beta cell. I hope you have understood it well. Still, if you have queries, definitely you can ask me on my WhatsApp number. Okay. So starting with the next topic, that is the abnormalities which are related with the insulin secretion. If you recall, in last lecture, video lecture that I have prepared, first slide of that I mentioned learning outcome, and last learning outcome was to understand the abnormalities which are related with the insulin secretion, right? So this is what we are going to start with. First we will learn what happens if there is lack of insulin. This is exactly what happens in case of non-insulin dependent diabetes mellitus. Yes, it's one of the type of diabetes mellitus. ગુજરાતીમાં તમે જેને મધુ પ્રમેહ કહો છો, right? Very famous and very much prevalent disease in India, right? As well as globally. Fine. So consider a case that if there is a lack of insulin, right? Now you will say that when there will be lack of insulin. So lack of insulin will happen in case when there is either autoimmune condition, right? Autoimmune condition could be because of genetic problems, or it could be sometime because of viral infections at the early age also, right? And you know that autoimmune disease, your WBCs, which are the cells of your immune system, they are not able to recognize between self and non-self, right? So the proteins which are present on the cell surface, they are not able to recognize them. In such a case, they start attacking on your body cell, right? And say for example, if the target is pancreatic beta islets, right? So such a case, the machinery for synthesis and secretion of the insulin secretion will be absent. So there you can consider that it will result in lack of insulin. Because here there is a lack of insulin, we call that type of a diabetes mellitus as a insulin dependent diabetes mellitus, because as a treatment you need to give insulin. The person is dependent on the insulin, right? He or she has to take insulin from outside. That's why you call as a IDDM, that is insulin dependent diabetes mellitus. Okay, so we'll see what happens. Insulin definitely is anabolic hormone, right? We have learned in the last lecture physiological action of insulin. So in that virtue, you know that it is anabolic hormone. If there is lack of insulin, there will be two conditions. Definitely now there will be decreased anabolism, right? Now glucose will not get converted to glycogen. Smaller lipids will not get converted to fatty acids. Okay. Similarly, there will be simultaneously increased catabolism also. More glycogen will be converted to glucose. Okay. So these two conditions, right? Additionally, you can also consider that utilization of glucose in some tissues like liver and muscle, that will get decreased, right? So if utilization is decreased, if anabolism is decreased, and if catabolism is increased, this all will trigger the blood sugar level, right? Normally it is maintained between 80 to 120 milligram per dl, and now in this condition, that is wherever there is lack of insulin, it will increase above 120 milligram per dl. That conditions we refer as a hyperglycemia. Hyper refers to increase, glyce, that is glucose, and amia refers to blood. Okay. Also there will be hormonal imbalance. You know that there are some hyperglycemic hormone. You can just see that there will be increased secretion of such hormones. Glucagon, you know that it is antagonistic hormone for insulin, right? That is released from the pancreatic delta cells, right? From islet of Langerhans. Growth hormone, that is anterior pituitary hormone, also hyperglycemic. Catecholamines, that is adrenaline, that is released from adrenal medulla. And finally cortisol, that is a glucocorticoid released from adrenal cortex. These all, because they do produce hyperglycemia, they are referred as a diabetogenic hormone. Okay. So overall the effect is hyperglycemia. We have understood this terminology. You just divide these words and then you can definitely will be able to understand this. Okay. Now when you have lots of sugar in your blood, right, lots of glucose in your blood, then why diabetic patient feels fatigueness, right? You should ask yourself, ભાઈ ડાયાબિટીસ કોઈને થાય તો એને વીકનેસ કેમ લાગતી હશે, થાકી કેમ જતો હશે? So the answer is the cell is having the glucose in the tissue fluids, but the utilization of glucose is not properly regulated. Okay, cells like cells of skeletal muscle, liver, it is totally dependent on the insulin action, right? Because the expression, the translocation of GLUT4 are the carrier protein molecules which allow the entry of glucose. Glucose is a polar substance, as such cannot cross cell membrane, but the entry will be facilitated by presence of insulin. Whenever there is an insulin, it allows that glucose to enter via these GLUT4 transporters. And whenever there is a condition where you are having lack of insulin, even though blood sugar level is high, but the glucose will not reach to cell, and that is the reason why person feels fatigue. Okay. Now this hyperglycemia will also be reflected in glycosuria, right? What is glycosuria? Urea refers to presence in urine and glyco again refers to glucose. So if there is hyperglycemia, this automatically will get reflected as a increased in the glucose level in the urine. Remember that the homeostasis of glucose is also maintained by the reabsorption of glucose from PCT and DCT, largely from the proximal convoluted tubule, but there it reaches a threshold when you have blood sugar level up to 120 milligram per dl. You know that basal values are between 80 to 120 milligram per deciliter. But if blood sugar levels are more than 120 milligram per deciliter, then the rest of the extra amount of glucose which is filtered from the glomerular filtration, right, from the Bowman's capsule, now that cannot be reabsorbed, right, because the coupled transport of sodium and glucose, that definitely reaches to a threshold. So up to 120 milligram per dl it will get reabsorbed, but then more than that it will be leading to an hyper sugar condition, right, the increase in sugar condition in urine, right, and that as an abnormal constituent will be excreted out from the body. Okay, so increase in blood sugar level will be reflected as a glycosuria. Now you know that glucose is a very important and easy medium for growth of bacteria and fungus. So you can just see that vulva is female genital organ, right? The external genital organ in female is referred as a vulva. And itis, you know that it is inflammation. So vulvitis, balanitis, right? So these are some of the fungal or bacterial infection which is because the sugar level in urine is high, right? Further, presence of glucose in urine will increase the osmotic pressure. It will generate the osmotic pressure, and that will drain more water. Glucose as such will not be excreted. It will also take water with the while the excretion of sugar. In such a case, you know that cis is process, uresis, that is process of urine formation, and di means more, large quantity. So process of formation of large quantity of urine is called as a diuresis. But here diuresis is because of the osmotic pressure, because of the presence of sugar in the urine. So it will lead to osmotic diuresis. And now you can very easily understand that why people suffering from diabetic, they have a frequent urination, right, as a symptom. Poly, that is more, urea, that is urination. So polyuria. Similarly, polydipsia, dipsia means thirst. They have to drink more water because they are going for frequent urination. That's why they have to drink more water. These are very common symptoms, early symptoms, right, in case of type 1 diabetic patient. Okay, so simultaneously we are also learning the symptoms of type 1 diabetes, right? And that is the what you call as the interesting part, or the for as far as the learning is concerned, right? How easy it becomes when you know that what happens in pathology, and then symptoms looks very easy, right? You don't have to mug up these symptoms. Okay, moving ahead, definitely diuresis. When you have polyuria, polydipsia, there will be lots of salt and water depletion. This could lead to hypotension. This could lead to what you call as a dehydration, and eventually in some patient it could lead to coma, death like conditions. Okay, this is in severe condition. It is not an instantaneous process, but this could happen. Fine. Moving towards the second, that is increased catabolism. We have referred. There is a glycogenolysis, right? That means the glycogen is now been more broken down. That is what you call as a catabolism. And gluconeogenesis, that is formation of, here it will be increased, right? Yes, you just correct, is rectified. Gluco refers to glucose, neo refers to new, and genesis refers to formation, right? So there will be new glucose formation from sources like lipids, right, which normally do not happen. So this also further will trigger same hyperglycemia only. Additionally, it will lead to lipolysis. Again, remember, insulin is an anabolic hormone. As such, normally when released, it promotes formation and storage of fat. So it's a lipogenic hormone. But here there is lack of insulin, so it will lead to lipolysis. And lipolysis leads to acute weight loss, right? Within 1 or 2 months, patient loses 5 to 10% of the weight. That is what happened in case of type 1 IDDM diabetes, right? That is insulin dependent diabetes mellitus. Also, because of glycogenolysis, there will be wasting, right? Even because of the proteolysis, there could be wasting of muscles, right? So this all will lead to reduction in the weight. Lipolysis will also trigger the ketogenic pathway. Normally, lipid is not converted to ketones, right? That is in the liver, because the insulin is present, right? Insulin inhibits this step. But in absence of insulin, because glucose is not available as a source of energy, body will try to utilize ketone bodies as a source of energy, right? And that will lead to hyperketonemia. Again, you can just see that amia, that is blood, ketone, and that is definitely increased. So hyperketonemia. Now hyperketonemia sometimes could be so severe that it could be sensed in breath of the diabetic patient, right? Just like we have some breath analyzer for alcohol, similarly for ketone analyzing, right? Analyzing the level of ketone, such analyzers can be used in breath, right? Analyzing the ketone levels in the breath. So that again is a very common symptom that you can observe in case of the patients who are having a very high sugar level. Similarly, these ketone bodies will also get excreted in urine. Remember, sugar and ketone bodies are not normal constituents of urine. Okay, so this is called as a ketonuria. Just like we said that glycosuria is presence of glucose in urine. Similarly, ketonuria is presence of ketone bodies in urine. So that is a resultant effect of actually hyperketonemia. Additionally, these ketone bodies are acidic in nature. That's why they produces acidosis, metabolic acidosis. Your pH normally is maintained in a strict range between 7.35 to 7.45, right? And such a case, if there is a decrease in pH, right, that is metabolic acidosis, which is a medical emergency. Acidosis, you know that once there is a higher amount of carbon dioxide level, right, or acidity, right, in the blood, this can be sensed by some of the cells, right, present in your medulla oblongata, which will increase the rate of respiration, right? So that is hyperventilation. Also the case that presence of ketone bodies will lead to vasodilation. You can just see that if this is a normal vein, in presence of the ketone bodies, there will be increase in the diameter. There is a vasodilation. You can just see that diameter is increased, right? Because this is blood vessel, that's why vaso. And you can just see that here there is dilatation. Okay, so this is, you can just see that the the action of the hyperketonemia. Okay, so hyperketonemia is a very serious condition, right? And wherever there is an hypotension, wherever there is a vasodilation, that definitely it will lead to hypotension, because more the dilatation of the vessels, lesser will be the tension exerted on that. Additionally, you also know that the vasoconstriction and vasodilation also is very important phenomena to maintain the body temperature. And wherever there is an increase in blood flow, it could trigger hypothermia because the heat loss will be more, right? Especially in the peripheral tissue. So such a case, it could trigger hypothermia. Fine. So these are symptoms of diabetic ketoacidosis. This is a very important topic which you will learn in higher semester, and this is also a very life-threatening complication of diabetes, right? As such, diabetes on a long term leads to multiple complications, but diabetic ketoacidosis could be life-threatening. It could result in coma and death. Okay, so very detailed description, right? That we have discussed, that what will happen if there is lack of insulin, right? Yes, this is what we have discussed, hyposecretion of insulin. This is called as a type 1 diabetes mellitus, right? And IDDM, right? Right now it is being referred as a IDDM. I hope you have remembered the full form, insulin dependent diabetes mellitus. Another one is a type 2 diabetes mellitus. We'll discuss later on, right? That is called as a non-insulin dependent diabetes mellitus. Okay. Why we are calling as a diabetes? Because it leads to polyuria, increased in the urine formation. But why increase in urine formation? Because there is honey like urine, right? Mellitus refers to honey like. Honey means sugary, right? Because urine is having glucose, and that leads to osmotic diuresis. That's why it is referred as a diabetes mellitus. One more diabetes that we have learned in the previous lectures, if you remember, is diabetes insipidus. There also we call it as a diabetes because there it is polyuria only, but there we call as a insipidus, not as a mellitus, right? So what do you mean by insipidus? Insipidus means it is tasteless, right? Latin terminology insipid, that means tasteless. Pathology of both disease also is different. Here there is, in case of diabetes mellitus, there is lack of insulin, right? In case of diabetes insipidus, there is deficiency of antidiuretic hormone. You know that once antidiuretic hormone is less, definitely the reabsorption of water, right, and from DCT and collecting tubule will be less, and that will lead to a very dilute urine. Because that dilute urine is not having salt, right? It appears, right? It tastes like insipid, that is tasteless, and that's why the name is been derived as a diabetes insipidus. This is just for your information, because many times in exam it is been asked differentiate between these two disorder, or it could be sometime asked just explain diabetes insipidus. That time you should not get confused with diabetes mellitus. Okay, fine. So just go through that through your books references, and still you have query, definitely you can ask. Yes, definitely major complication of diabetes mellitus symptom, that is hyperglycemia, and that will result eventually in all this, right? We have learned this. Polyphagia refers to more eating, right? Phagia refers to eat, right? Diabetic patient do have these symptoms also. They also have predilegency for sweet food. Normally it happens, psychological effect. And when someone tells you that you don't have to eat, you have tendency to eat that more and more, right? So that could happen. Lethargy, weakness, this all could happen. Diabetic ketoacidosis, we have learned. Treatment, definitely you need to give insulin hormone, right? Previously the insulin was given from animal sources. Now humulin, that is human insulin, that is synthesized by biotechnological method in E. coli, is given. That is either by intravenous and more commonly by subcutaneous. But definitely you cannot give by oral route. Why? It is peptide. It will be easily denatured, hydrolyzed by the presence of acid, and that's why it cannot be given by oral route as such. Some modification for administration of oral route, they are being designed by pharmaceutical companies, which you will learn in the higher semester. Okay, sometimes insulin is given with some other substances like zinc or maybe protamine to increase or change the surface characteristic of insulin, which will allow it to act for longer duration, right? Insulin as such is having a very low biological half-life. Okay, for you just need to go through different types of diabetes mellitus, and you need to have idea that what is the difference between diabetes mellitus and diabetes insipidus. Okay, this is what up to your level is important. Fine. Hypersecretion of insulin normally do not happen, right? But it could happen in case of fluctuating level of diabetes, right? This is called as a hyperinsulinism. It could be sometime patient or physician error also. Such a case, you know that insulin, because it produces reduction in blood sugar level, if there is more release of insulin or if it has been taken as a drug, then it can lead to hypoglycemia, and this could be very severe. See, hyperglycemia will not lead to instantaneous death, but hypoglycemia could lead to very serious complication, right? And death of the patient could also happen in this case, right? This is normally observed as an insulin shock, right? If diabetic patient is there, definitely he or she is taking insulin as a medication, and if just after fasting or maybe just after doing lots of exercise, if a high dose of insulin is being taken, then in that case hypoglycemic shock could happen, right? And that could lead to and that's why diabetic patients are advised to keep chocolates in their pocket. Fine. Through some diagrammatic representation, we are going to revise this detail. Consider a case that you have taken some food. This is esophagus, this is stomach, right? Consider this is a sweet food. You have taken gulab jambu. Yes, must be happy now. Fine. So consider that, yes, just for joking, nothing else. But then consider that this food is been taken. Definitely this will be processed by your digestive system, and then it will lead to absorption of glucose from the gastrointestinal tract. Okay. So eventually the simplest form, diffusible form of sugar, that is glucose, will be absorbed from the digestive system. You know that pancreas, you have islet of Langerhans. Islet of Langerhans, you have 60% of these cells are beta cells, and beta cells are as good as sensory nerves. So wherever there is an increase in blood sugar level beyond 120 milligram per dl, your beta cells will be able to sense it. Then we know that through chemical signaling, they releases the molecules, these pink molecules which I have shown here, they are the insulin, right? You know that it's an endocrine organ, so this insulin is released directly into the blood. This is within the blood vessel. These are RBCs. This is insulin, pink one, right? And this white one that I've shown is the glucose. Okay, so this glucose will be taken up by cell wherever there is a presence of insulin. This is insulin receptor. So wherever this insulin, because it is peptide, it will act on this cell surface receptor. So insulin will be bound to this insulin receptor, which is cell surface receptor. And now you can just see that green signaling, right? That means this transporters, right? This is your cell membrane, phospholipid bilayer. And these are some special proteins, carrier proteins, which we call as a glucose transporters, GLUT, right? This will allow the entry of glucose. Once glucose is entered in the cell, now it can be utilized to be converted in ATP. Also, the extra amount of glucose can be converted to glycogen. Now, what happens in case of type 1 diabetes? You can just see that previous slide, there were all these receptors were occupied by insulin. But here in this diagram, as you can see that the insulin is deficient, right? Because in type 1 diabetes mellitus, that is insulin dependent diabetes mellitus, your body is not able to synthesize the insulin, right? Because beta cells are destroyed. Such a case, deficiency of insulin, now glucose cannot enter. Because it is not able to enter, it's not able to utilize. Now this will result in hyperglycemia. Second condition, which is referred as a type 2 diabetes, that is non-insulin dependent diabetes mellitus. Now here you can just see that insulin is there, but once insulin is bound to receptor, either there is defect in insulin or there is defect in activation of this receptor, which is more common, right? So this receptor becomes insensitive, or they are not functioning properly for the action of insulin. This effect is termed as insulin resistance. Insulin resistance is again genetic in nature, so it is hereditary disease, but then it could be provoked by some environmental conditions like sedentary lifestyle. Sedentary lifestyle, like that means you are eating lots of calorogenic food, but then you are not doing exercise, right? So if physical activity is absent, then definitely this could increase the chances of uh, such type of an disorder, right? So here there is an insulin resistance. Remember, in case of the type 1 diabetes mellitus, there is deficiency of insulin, right? Beta cells are destroyed. That's why 80 to 90% of the total insulin levels have been fall. You have to take insulin from outside. In type 2, insulin is there, but the receptors are not working properly, right? There is defect in the post receptor activation process, and such a case, again, resultant effect is glucose is not able to enter within the cell, right? You can just see that red signaling that I have shown in the diagram. Such a condition, the resultant effect is, you can compare with the previous diagram, right? This is again within blood vessel. Now these white molecules are more, that means there is hyperglycemia, and outside the cell there is lots of glucose, but definitely this glucose is not able to enter inside the cell, right? So our cell are starving for food, and you know that if this happens for years, for months and years, it would lead to damage to this organ. You can just consider simple, very simple example I always give to my student, that you have two organs. One you have kept in simple saline solution, second you have kept in a syrup, right? Chasni में राइखो हશે તમે. So then definitely which organ will get damaged first? So the sugary solution, right? So that will definitely stimulate, right, the damage of the organ. So this same thing happens to our body, because you have lots of sugar around the cells, around the tissues. That organ, that is kidney, your eyes, right, then your heart, right, all organs, they eventually start damaging, and there is a multi-organ failure. This is the problem with the diabetic patient in the long run. Okay, so with this we have completed our lecture. You need to give assignment to me, right? This is a very important disease that is asked in the exam, right? As such, the differences are not asked in the exam, but definitely as an explanation, right? Short questions of 2 marks, 1 marks, they have been asked. But if you try to find out differences, it will be very important and informative for you for understanding of what we have learned in the lecture, right? So you need to find out difference between IDDM and NIDDM, and you also try to find out difference between diabetes mellitus and diabetes insipidus. Okay, thank you very much.